So we're going to do a little bit, I'm going to show you a little bit of the teaching that I would do with patients. So first of all, we need to know about this. What does it do? Well, a lot of people will say, well, it's going to prevent pneumonia. Yeah, all right, it very well could prevent pneumonia. But what it's going to actually do, it's going to help prevent atelectasis. That's for medical people, we'll just talk in medical terms. Prevent atelectasis or collapsed alveoli. So when somebody's sitting in bed for a long period of time, you might have difficulty, they're going to take short squatty breaths, and they're going to have atelectasis. Well, we all have it, but when you're in bed for a long period of time and you have atelectasis, yes, you might be more prone to pneumonia. So this is going to prevent atelectasis. It doesn't necessarily reverse it. We have other devices like the EasyPap, AccuPap, the old IPPB would reverse atelectasis. This is just going to prevent it, so that it really helps a lot with that. Generically, a lot of people say, well, it prevents pneumonia. Yeah, kind of a roundabout way, but if you really want to explain it to your patients, it's going to prevent their air sacs from collapsing and remaining collapsed, and it's going to keep them open, especially after their surgery. So we know that my goal after looking at the sheet was 2,600. So one thing I definitely recommend for your patients, put the goal on here. Okay, give them their goal. Don't just say somewhere in the 2,000 to 3,000 range. And this piece right here is really nice, but look, it slides. So I recommend actually marking it on here with a permanent marker where their goal is. All right, so we know that's the goal for Jimmy. My name's on the bottom of it. There's my goal. That's where I want to get the bell to each time. So that's nice because this thing moves all over the place. So the second part of this, give them the goal, and then think about the name. So this is called an incentive spirometer. So if I'm going to go teach this to the patient, I need to give them an actual incentive for doing it. Now, it's going to prevent pneumonia. Not a great incentive. You know, what if they never had pneumonia before? They don't even know what it's like. So, I've never had pneumonia, but you're saying it's going to prevent pneumonia. No, give them an incentive that's something that's tangible for them. Most normal patients in the hospital, number one incentive for them, what they want is they want to go home. Write the incentive on there. So when it's sitting here on the table across from them, they look over here and they say, well, I'd really like to go home. And what's one incentive of doing the incentive spirometer? It's going home. Write their incentive on here. If they want to go home and feed their dogs, or if they want to, you know, whatever they want to do, write it on there. Another great incentive that you can use is decrease oxygen consumption or decrease oxygen level. So everybody, if they would come in the hospital and let's say their oxygen saturation is a little low, they might put them on a couple liters. Well, people automatically think, shoot, I'm going to be addicted to oxygen. Well, unfortunately, we're all addicted to oxygen, just usually in the room air form. But the best way to decrease our oxygen need is do an incentive spirometer, because it's going to open up alveoli. You're going to use all of your surface area for oxygenation, and we can decrease the amount of oxygen we're delivering to them. So, as I wrote on here, home, you could write decrease oxygen, anything like that. So when they're sitting there with the nasal cannula in their nose and they're wondering, and I really like this thing off, well, maybe I can do this. That's the incentive of doing this spirometry. So make it tangible for them. I mean, because if it just sits there and you just show them one time, it will probably end up being more of just a, you know, some kind of decoration for their bedside table. So rather than an actual medical tool. So we're looking at this. Another thing that I find a lot is I'll hand it to a patient. I'll just say, would you like to show me how to do this? And this was set up maybe days before. About 75% of the time, you get this. They blow into it, right? Blowing into it, that's, you know, that's fine. They can blow into all they want, but that's not doing its purpose. Its purpose is for you to take the breath in, for it to fill your lungs to your full capacity. A lot of people also get hung up on this area over here that predicts flow. Don't get hung up on that as much. Yeah, I don't want them sucking their breath in really fast and letting it out really fast. That's not going to do much. But a lot of people focus more on that than they do the volume. The volume is actually what's going to reverse atelectasis. So I actually tell them to put their hand over it so they're not looking at it initially when they start off. And then so have their hand over this. We can see the level, my goal here. Have them fully exhale, put this in their mouth, take their breath in. I'll show you one little extra tip that really makes every breath work well. So exhale in mouth. So you notice what I did different there than a lot of patients do? A lot of them will do this. Take the breath in and immediately exhale. If you want to make this really, really work, have the patient hold their breath until this bell that you see go up and go back down, till the bell hits the bottom. What it's actually doing, it's like a sigh or a breath hold maneuver. Take the breath in, and what I've found when I've, put pig lungs on ventilators and all kinds of crazy stuff for testing, I've found that if you increase that time at the top pressure, that 5-6 second point of doing that, you start opening up alveoli. And that's really what happens with your patient. So the deep breath in to max that they can get, and then hold the breath until the bell hits the bottom. It's going to be way more effective than just taking your breath in and letting it out. So just to show you again. And exhale. So recruiting a lot more alveoli, making each breath matter. So some things you need to know about this also. We recommend 10 times an hour while awake. And also if a patient's in the hospital, I usually say 5 times during commercials, because that's usually all they have to do is watch TV. So 5 times during a commercial break, that would really help a lot. The breath in as deep as you can get and hold it is really key, because that's going to open alveoli until that bell hits the bottom, then have them exhale. So these are some common tips you can use for your patients that are on incentive spirometers to make the therapy that they're doing way more usable, more effective, and with this, it's all about compliance. You just want them to continue to do it. So that's it for the incentive spirometer.